Hello, my name is Asiyath Shifa. I am tutor and perfusionist from Yenepoya School of Allied Health Science, Perfusion Department. So today I am going to take on the topic aortic valve stenosis. So the SLO of the topic is the definition, causes, symptoms, risk factor, complications, prevention and treatment. So we will start with the definition. First I will start with what is aorta. Aorta, it is a main vessel of the heart which provides the blood to the whole part of the body. So what is stenosis? Stenosis is the narrowing of the valve. So what is aortic valve stenosis? It is a type of heart valve disease. The valve between the lower left heart chamber and the body's main artery is narrowed and doesn't open fully. This reduces or blocks blood flow from the heart to the aorta and to rest of the body. So shown here, it is the aortic valve which comes between the left ventricle and the aorta. You can see the part which is marked red is where the valve is narrowed. So that is the stenosis of the aortic valve. So I will begin with the causes of aortic valve stenosis. First one is congenital heart defect. Some children are born with an aortic valve that has only two cusps, that is bicuspid aortic valve, instead of three cusps, that is tricuspid aortic valve. An aorta has always three cusps. Rarely an aortic valve may have one unicuspid or four quadricuspid cusps. The valve condition may not cause any problem until adulthood. If the valve begins to narrow or leak, it may need to be repaired or replaced. Always we have to be prevented from the aortic valve. The second cause is rheumatic fever. It may cause scar tissue to form on the aortic valve. The scar tissue can narrow the aortic valve, opening or creating a rough surface on which calcium deposits can collect. Rheumatic fever may damage more than one heart valve and in more than one way. Now we will talk about the symptoms of aortic valve stenosis. An irregular heart sound, a heart murmur that is heard through a stethoscope, chest pain, angina or tightness with activity or normally, feeling faint or dizzy or fainting with activity or normally, shortness of breath especially with activity. Next, fatigue especially during times of increased activity, rapid fluttering heartbeat or palpitations, not eating enough mainly in children with aortic valve stenosis, not gaining enough weight mainly in children with aortic valve stenosis. We will continue with the risk factors. What are the risk factors one can have? First one is older age. Certain heart conditions present at birth, like mentioned before, bicuspid aortic valve, and aorta has three valves. Next, chronic kidney disease, diabetes, high cholesterol and high blood pressure, history of infections that can affect the heart such as rheumatic fever or infective endocarditis, history of radiation therapy to the chest. We will talk about the complications of aortic valve stenosis, that is heart failure, stroke, blood clots, bleeding, irregular heart rhythms called as arrhythmias, infections that affect the heart such as endocarditis and of course death. Now we will talk about the diagnosis of aortic valve stenosis. How do we recognize the aortic valve stenosis? Echocardiogram, electrocardiogram, that is the ECG, now chest X-ray, exercise test or stress test, cardiac computerized tomography also known as the CT scan, cardiac magnetic resonance imaging scan, that is MRI scan, and cardiac catheterization. Now we will talk about the treatment of aortic valve stenosis. First procedure is aortic valve replacement surgery, where cardiac surgeons remove the damaged valve through open chest surgery or minimally invasive heart surgery and replace it with a mechanical or biological valve. These valves are made from cow, pig or human heart tissue. Second procedure is balloon valvuloplasty, which is a catheter based procedure used as a palliative treatment to improve the symptoms of aortic stenosis when valve replacement is not an option. Balloon valvuloplasty is a catheter which is inserted into the aortic valve and inflated for more space for the blood to flow. The next procedure is TAVR or transcatheter aortic valve replacement, which is an innovative non-surgical valve replacement procedure now used in place of traditional surgery in many patients. Now, let's talk about the prevention of aortic valve stenosis. First, taking steps to prevent rheumatic fever. The strep throat can usually be easily treated with antibiotics. Untreated strep throat can develop into rheumatic fever. Rheumatic fever is more common in children and young adults. Keeping the heart healthy, talk to a healthcare provider for heart disease and how to prevent or manage them. They include high blood pressure, obesity, high cholesterol levels. These risk factors may be linked to aortic valve stenosis. Now, taking care of the teeth and gums, which we usually miss. There may be a link between the infected gums, gingivitis, and infected heart tissue, that is endocarditis. Inflammation of heart tissue caused by infection can narrow arteries and worsen the aortic valve stenosis. Let's summarize today's topic, aortic valve stenosis. It is a type of heart valve disease, the valve between the lower left heart chamber and the body's main artery, which is narrowed and doesn't open fully. This reduces or blocks the blood flow from the heart to the aorta and to the rest of the body. These are the references. Thank you.